Hi, welcome to Ask the Chiropractor. I'm Dr. Corey B. Rodnick, and today we're going to talk about children and chiropractic, and we're going to talk about extremity adjusting. And our special guest here, Toni Rodnick, soon to be Dr. Rodnick in about a few weeks, fresh off the presses. Hello, Toni.
Hi, it's a pleasure to be here, as always. And I love talking chiropractic with you guys because you're so focused on the principle and what chiropractic can do to help people.
Yes. And Dr. Paul Rodnick. Hi, Paul.
How you doing, Doc? Thanks so much for having me.
Yes, indeed.
I'm very excited to be here. Children and chiropractic is one of my favorite topics. It's one of the most underestimated topics in chiropractic. A lot of people don't understand how important chiropractic can be, especially for children. So it's a really fantastic topic today. I'm really excited. Thanks again for having me.
Yeah, so here, let's talk about children and chiropractic. First of all, why would children need chiropractic care? Go ahead, Toni.
Well, it all starts with the birth. It's a very traumatic experience for the children. And a lot of times it puts pressure on the neck and might knock the vertebrae out of alignment. So the nerves that come out of the neck control all the organs and tissues of the body. So if there's pressure on the nerves, you could have all kinds of problems, colic, headaches, misery, failure to thrive, all kinds of situations. So we want to make sure that the bones are all aligned and the baby has the best chance of developing properly.
You know, that's interesting because, many times through my 30 years of practicing, it's my 30th anniversary, everybody. Yay.
Congratulations.
Congratulations. Thank you. And with children who, like you say, thriving, I've had, babies who were not going to make it and get chiropractic care and do better. As well as I had some undeveloping children, like they couldn't crawl. 3-year-olds who are still not crawling, 2-year-olds who are not crawling. And a couple of adjustments later, boom, fixed.
For kids, it's usually not the aches and pains. The kids aren't usually complaining about their back pain. They're not usually complaining about their shoulder pain. For the kids, it's usually the other symptoms that you see go away. It's the asthma, the allergies, the failure to thrive, the baby can't crawl, behavioral disorders, ADD, ADHD, et cetera, et cetera. It's all the ones that usually you don't expect to see chiropractic helping. It's all the extra stuff. There's a public perception about chiropractic that chiropractors are neck pain, back pain, headaches, call that a day. But really, we do so much more. And for kids, you really see a response in that field.
I'm thinking right now of a study that was done with children, and they were comparing medical doctors. It was some 9,000 some odd medical doctors and 7,000 chiropractors that they interviewed on their children. And asthma was one of the questions, and the percentage was less than 1% for the chiropractic children, and it was like 90% plus on the medical side. So it's a very common disorder amongst certain people, where in other people it's totally non-existent almost. And I noticed that in the practice too. I'd have kids come in with asthma, and after a few adjustments, gone. Just I think I've almost every child, now that I'm thinking about it, that I've ever worked on with asthma in the office didn't have it after a very short period of time.
Absolutely.
And
Kids are amazing. They respond so quickly because their bodies are just developing, and they have this amazing recuperative power as they grow.
And in chiropractic, as with anything in the body, the longer the problem's been there, the harder it's going to be to correct. The same concept applies. The analogy I like to give is braces on your teeth. Kids who need braces on their teeth, they have to have braces on for, on average, about a year to 2 years. Adults who have to have braces on their teeth, they have to have braces on for an average of 5 years. And the concept is the same. They're moving bones in the mouth, we're moving bones in the spine, but the concept's the same. Children respond a lot faster to chiropractic care because their problems haven't been there as long. A lot of adults, they'll have problems stemming back to their childhood. They come into us 50 years later. It's a lot harder to get it stabilized, to get everything in place. For kids, you move it back in once or twice, and they're doing a lot better.
And
Granted, they throw themselves out pretty often. If you ever spend a day watching a child, they're jumping, they're falling, they're getting hit. They get thrown out pretty easily too, but they correct really easily, and growing up into their adult years prevents further problems. I'm sorry.
I was going to say, you were saying adults don't correct as easily, but they have a lot more degeneration and changes to the spine that need longer to correct.
Exactly.
There's another thing to consider. I find it very easily explained is the muscles have a memory, the ligaments have a memory, the tendons have a memory. If anyone's ever, eaten chicken, you see that stringy stuff is the tendons and ligaments, and there's a memory involved. And the longer you've had it in that position, let's say that something's been knocked out of place, the longer you've had it in that position, the more that memory is going to be there of it being in the wrong position. So if you just did something, there is no memory to put it back in that place because it just happened. Whereas if it's been there for 5 years, and again, it takes about a month for every year that you've had it out of place to correct. So in other words, like you're saying, the brace is on teeth. So if you've had it misaligned for a certain period of time, the memory, and same with the teeth, would have a memory. It has a memory of where it was. It has a memory now of where you're putting it. And it takes a while for it to stay there. That's why retainers are necessary. If you take the retainer off, the teeth actually will go back into its original position. Because of that, of the memory of that's been set in there.
And like I said, for adults, the average for an adult wearing braces is about 5 years. So let's say I'm an adult, I've had braces on for 5 years, my teeth look great, and now my orthodontist says, well, you got to wear a retainer now. And I say, it's been 5 years, there's no way. And I don't wear the retainer.
It goes back.
The teeth will just shift right back.
And what's doing that is the ligaments and tendons and the muscle memories. And so that's why it's so great working on kids, because they don't have the memory yet because they're only 1, 2, 3 years old. Where an adult 50 years later, totally different, harder to work on. Takes a lot longer, much more aggravating. You just want to noogie them. Like, what did you do that for? Okay, so that's how that works. And so if somebody has like a car accident, and you fix it right away, you get to it, the first week, and you're on it, the time period to correct it is so much less than if they wait a year or two or months down the road, because then you have scar tissue, ligament memory, and all that stuff going on.
Or even worse, they get in a car accident, wait a year to get it corrected, and then instead of getting it corrected, get in another car accident, and then come in.
Yeah, there's a biggie.
So now we got the original injury we got to deal with, and then on top of that, we got the new injury we got to deal with. Getting in as soon as something happens is very important.
So you're talking about kids. So I was babysitting 2 of my little grandbabies, and the week before that, I was playing with my little grandbabies, 2 other ones. And so we're there, and my one granddaughter, she's 2, and I'm in Georgia, and she bumps her head getting in the pool. There's a metal bar. So she hits her head, and then she hits it again. And I say, you're not allowed to hit, her name was Abby. I said, you're not allowed to hit Abby in the head. No one's allowed to hit Abby in the head. I don't care who they are. And she looks at me, and then about 10 minutes later, she bumps her head again. I go, I thought we talked about this. Anyway, but my point is, how many times a day does that kid hit herself in the head?
Or any kid.
Or every kid.
Right. Although she's smart enough to say, hey, I need an adjustment, Will you check me? I need an adjustment. So that was nice. But anyway, the convenience of having family as chiropractors. But, it's how many times do they fall, and how many. I remember each day, at least a couple of times a day, she would wipe out. Just because she's goofing off, and then boom, and
every kid.
You get up, and you worry about the scrape. No one's looking at the neck and the spine, and every kid, any healthy kid. Unhealthy kids are the ones who don't fall and don't get hurt ever. That's a scary business. That means that kid's very, very ill. If they never get bruises, if they never get, as far as the way I look at it, is I'm always worried that what's wrong with this kid.
Because it's normal for kids. It's normal for kids to get out and play and be active. And yeah, the kid who sits in front of his TV all day and doesn't do anything and sits in this posture playing video games, he's going to grow up and be the old man walking around like that.
The sad part is in our culture today, kids don't go out and play and be active. The TV is the babysitter, the TV is the fun activity, and so they miss out on all the physical growth and development that they need to become healthy adults.
You were going to bring up something about, what was it? Primitive, something where they, go ahead.
Retain primitive reflexes.
That's the one.
There's a
Let's say that slowly so we get it. Retained primitive reflexes. What is that?
Well, when we're infants, they have these primitive reflexes that help them survive as babies. Like you stroke their cheek and they turn their head to nurse. It's called the rooting reflex. And there's many primitive reflexes that are supposed to be extinguished at certain levels, certain ages.
I know Babinski's sign was one of them.
Babinski's sign.
I remember that. I'm going back 30 years, folks, so you know.
That's when you stroke the bottom of the foot and the toes flay and go upward. And it's normal in a baby, but in an adult it shows there's neurological problems. So as the child develops, the brain is developing. When the child is born, the brain is not fully developed, and it develops from the bottom upward into the thought areas, the higher cognitive reasoning areas. And if there's some reflexes that are not extinguished, it can have the brain development be irregular. The right side might go ahead of the left side. It might stop you from doing certain things. Like there's a reflex with the foot.
By the way, this is what happens when your wife goes to chiropractic college. Go ahead, continue.
When you rub the top
Sorry.
of the foot, they start moving their feet like walking. And if that reflex is not extinguished, the crawling is irregular, and there's all kinds of problems caused by them not crawling properly. So if you get rid of the primitive reflexes that are supposed to be gone, then it helps the baby develop more properly. And they're showing that a lot of people with ADHD and behavioral disorders have primitive reflexes that haven't been extinguished. So you need to have, it's called functional neurology. And so you need to do certain things to help them extinguish the reflexes so their brains can develop properly and move on.
Who does this kind of work?
Well, there's a...
Other than Toni Rodnick going to be, but...
Well, like I said, there's a branch called functional neurology.
Okay.
Most of it was developed by, there's a groundbreaking doctor, Dr. Robert Malalo, that developed a lot of these things. Dr. Carrick was at Life University. He was a functional neurologist. People came from all over the world to see Dr. Carrick, and he was working on functional neurology. Not necessarily totally primitive reflexes, but the functional neurology, working with developing neural pathways and helping the body heal properly by restoring the neural function.
To the public's eye, I don't think this exists even yet. So you said groundbreaking. So this is just something very new.
Yeah, it's very new, and I don't think it's just chiropractors. Like I said, it's new. It's a new field, functional neurology.
Interesting. I know that if you don't crawl and you start walking first, that's a problem. That would be functional neurology.
Yeah.
And that's been around for 50 years.
And some babies, they don't crawl, they scoot, they do all kinds of, they don't do the cross crawl. You need to have the integration of the left and right side of the brain, and you get that when you're crawling. You move the right arm, the left leg, and then the left arm and the right leg, and it helps develop the brain, the neural pathways in the brain.
They call that the reticular fibers, I believe. It develops between the two halves of the brain is the, God, I'm pulling this out of 30 years of memory. Anyway, yes, Paul, Dr. Paul.
I just kind of want to change gears for a second and just kind of rewind, because we're going into a lot of good information here, but I just want to give the audience a background here. When you were asking right at the beginning of the show, you said, why is chiropractic good for kids? And I want to answer that with another question and then an explanation. Why is chiropractic great for kids? Why is chiropractic great for everybody? And that's the real question. What does chiropractic do? And I just want to take a couple minutes and explain what we're doing, how it affects the body, and then we can go back and discuss why that's so important for kids.
Absolutely.
Because a lot of people, again, like I said, there's a public perception out there that chiropractors are good for neck pain, back pain, headaches, but really we do so much more. We're not just spine doctors, we're more so nervous system doctors. Basically how the body works, the brain sits right up top, controls everything in the whole body, whether it's your heart, your lungs, your digestion, you name it. Your brain controls everything in the whole body. And it does it all from the brain down through the spine, through the spinal cord, and then going out to each of the little nerve roots coming out of the spine, going everywhere in the entire body, whether it's the areas that you feel the pain or the areas that you don't. Those nerves, there's only so many on each side, so some of them are going to, this one's going to your organ, and that same one splits off and goes to your low back pain. So people that say, oh, I have low back pain, what they don't realize is I also have kidney issues, or I also have digestive issues. And we see that a lot in our office. We see the side benefits. Somebody will come in, they'll say, ever since I've been getting adjusted, I never had digestive issues, but my low back pain's going away, and that's great, but also I feel like I'm digesting my food better, or I feel like I'm sleeping better, or you name it, because chiropractic really affects everything. Those same nerves, like I said, that are going to the pain areas are the same nerves going to the organs. So a quick example, going back to little girl who's skins her arm. Little girl falls off her tricycle, skins her arm. Everyone's worried. Oh, is she okay? Is the skin okay? They get a kiss her on her skinned elbow, and 2 minutes later, she's back out on her bike again. Right? But what we didn't know is what else is going on.
Ready for this? So she falls, skins her elbow, and that pushes the bones out a little bit here, twists them just a little bit. And then 3 months later, this little kid has asthma because the nerves in here go to the lungs. And asthma is just a wrong reaction to normal breathing. You're like, if you're in smoke and you're coughing and you're breathing hard, and that would be normal. But breathing regular air, that's not normal to have that kind of reaction. And that's how they do it. When they fall, then they catch themselves, it knocks these out.
Absolutely. And the example I was going to give too was even a more long-term example, because the asthma, you do notice the asthma in kids. The one that I was going to go with was she falls off her bike, she skins her arm, but we didn't realize that when she fell on her hip, she misaligned the bones in her lower back, she pinched off the nerves going to her reproductive system. Right? Now, as a
20
little
years
girl,
later,
exactly.
she can't have kids, and they don't know why.
The asthma one, you're going to realize that 6 months later, a year later. The reproductive system one, you're not going to realize that for 10 years, 20 years, 30 years down the road. Yeah, now all of a sudden she can't have kids, or she's got an abnormal cycle or painful cycle, or something's going on. And that all stemmed back from when she fell off her tricycle when she was 3.
Have you had women where they couldn't get pregnant, they got adjusted, they got pregnant right away?
Mm-hmm.
Okay.
Yep.
Yeah. I had zillions of them.
And then they come in and they say, oh, Doc, thanks so much. You got me pregnant.
Yeah.
And
I'm like, oh!
No.
It wasn't me.
Careful what you say here.
That's right. Yeah, that is what they say, too. It's exactly the words. You got me pregnant.
In my office, too, we have open adjusting rooms, so when people come in and say that, I gotta announce. Yeah. Let me clarify this here.
That's something, isn't it? Man.
But yeah, great for developing mothers, great for pregnancy too, during pregnancy. If those nerves are being pinched off going to the reproductive system, the baby might not be developing quite properly. You want to make sure the mom's nervous system's working right when the baby comes out first thing. We talked about the birth process a little while ago. The birth process is a very traumatic process. Even the ones they say are non-traumatic. I've seen births where they say, oh, baby's not going to fit out, we got to break both their collarbones. And then when it's all said and done, they say, well, that was a non-traumatic birth because everything went as planned. It's still very traumatic.
Very traumatic.
But even the ones that go perfectly smooth, perfectly as planned,
they're still traumatic.
They're still traumatic. The method right now that they use in hospital to deliver babies is actually called the corkscrew maneuver of child delivery. And the reason it's called the corkscrew maneuver is because it resembles a corkscrew. What they do is they grab the baby by its head and they twist it about 90 degrees, and they yank on them with about 65 pounds of force. Right? When you think about that, if somebody did that to me right now, turned my head, yanked on me 65 pounds of force, that's not going to be very good for me.
And this is a neck that isn't developed enough to hold a head.
These aren't even newborn babies. These are just born babies. First, second in the world getting their head twisted. And then, as if that wasn't bad enough, we have, can't get enough force to get that baby out, so what do we got to do? We got to grab these metal salad tong-looking things, clamp it to the baby's head, twist them 90 degrees, yank on them with 75 pounds of force. That's not enough. What do? Just stick this vacuum. We got a combination. It's a vacuum with a plunger on top of it. Stick it to the baby's head, turn them 90 degrees, yank on them with about 85 pounds of force. All that could be very traumatic. Then we have the C-section. A lot of people say, oh, the C-section is so great for the baby. the C-section is not great for the baby. The ones we were just talking about, you have the nice natural birth canal to go through. The C-section, you have skin, muscle, tissue that you got to get the baby through. So the doctor actually grabs the baby by its head, kind of wiggles it out. I'd say probably 8 or 9 times out of 10 we get kids in the office that were C-section kids. They'll have pretty severe misalignments, right? Usually the top 2 bones in their neck will be misaligned.
And those are the most important bones,
And
too.
those are the most important ones because that's where the brain transitions into the spinal cord. It's the area that's called the brain stem, really highly neurological area. Misalignment in that area can affect the body all throughout. So definitely really important for kids to have chiropractic, especially right after the birth process, but all throughout growing up, because the key is you want to take somebody that's healthy and keep them healthy and grow them into a healthy adult compared to, if it's not broke, don't fix it, don't worry about it. If they don't have any pain, well, that's setting them up for, 20 years down the road to have pain. You want to make sure preventative maintenance is key. That'd be the same as saying, well, I don't need an oil change in my car because it still works. I'll change my oil once my engine explodes. It's setting up for failure. You really want to make sure preventative maintenance, keeping healthy things healthy so they can continue to be healthy in the long run.
So what's it like adjusting kids? Maybe you can go into that a little bit.
For me, very rewarding. The kids really see results right away. For the kids, again, very rewarding. They see the results right away. A lot of people are concerned when they ask me, well, how do you adjust a kid? Because when you adjust me, you're jumping on me and you're yanking on me. And absolutely same type of thing. We're jumping on them, we're yanking on them, we're twisting them. But to a different level. It's much more gentle. For an adult, again, the longer the problem's been there, the more the muscles, the tendons, the ligaments are holding them in place. It takes more force. For kids, everything moves in nicely, holds in better because everything's not pulling it back out again. So really gentle adjustments. Sometimes when I adjust a kid, it'll just be light, sustained contact. I'll just be putting pressure into them.
Just light and gentle.
Just light and gentle.
Yeah. A lot of times they just fall right in by themselves. They
More
just
often
touch
than
it
not,
and
yep.
falls in. Yeah.
And when somebody sees the difference between the adult adjustment and the child adjustment, they say, oh, that makes sense now. Just because it's the same thing. I'm contacting the same points. I'm putting the pressure in the same direction. But it's just more light force. It's a lot easier to adjust kids.
A lot of chiropractors don't adjust kids. And so obviously you have to have the right hands-on kind of thing to adjust kids. I know I do, you do, she does.
It's a slightly different adjustment. Like I said, it's more gentle. It's just slightly different. So if you're not in practice of it, you're not as used to it.
And here's the opposite. I've seen you adjust, a 7'6", 380-pound people, and I have pictures. I found it. That was the funniest picture I was taking with you. You're just so small compared to these giants that you're working on, and because you're the chiropractor for the Saginaw Sting and for the Arnold Classic.
Mm-hmm. But just a lot of athletes. Athletes respond really well to chiropractic too. And same kind of thing, more often than not, athletes are getting adjusted not for their aches and pains. Well, don't get me wrong, a lot of times athletes do get aches and pains.
Yeah.
But again, for performance. They're trying to be at their 100%. They want their brain communicating with their body. So everything's working at 100%
Peak
so they can perform better. Exactly.
Yeah. I know at the Arnold Classic, you're adjusting kids. They're like, what are those?
Gymnasts?
They're probably 8 or 10.
Some even younger, some even
younger, and then to about 14, 15, to about 18 actually.
So some of the gymnasts at that competition I think are 3, 4 years old. Some of them are 18, 19 in the gymnastics competition. Then some of the other athletes are 30s, 40s, just there to power lift or come in and get adjusted because they have a chiropractor, they understand the importance of it, and we're the ones that are there giving the service.
Yeah. So that's. Like you said, they're mostly, their coaches bring them over to get checked out. Most of it is for performance. It's
exactly.
All, you can, if everything's equal and you're lined up and the other person isn't and everything else is equal, the lined up one's going to win every time.
And again, just performance-wise, a lot of people look at things, they don't look at the performance end of the spectrum. They look at the pain end of the spectrum and they say, well, there's nothing wrong with my kid. He doesn't have any pain. He doesn't need the chiropractic. Well, could it be better? More than if there's misalignments, if there's pinched off nerves, getting rid of those, even though they don't have the aches and pains, they'll still be better. And it'll be, for kids more often than not, you'll notice a difference with their behavior, with the small things, the asthma, the endurance, that kind of thing. You don't get the aches and pains, but we're looking at the positive end of the spectrum. They're getting more abilities. Everything's getting better instead of people saying, well, there's nothing wrong with them. Don't fix them. The kids, you know, we want to have them at 100%. We don't want to have them in pain. You know, we want to make sure we avoid that.
Go ahead.
The signal from the brain to the body, it's a two-way signal. It's also the body to the brain. And the signal from the body might tell the brain the proprioceptive, where the body is positioned. You know, besides pain, you know, it tells the brain a lot of things. So if the brain is not getting proper information, then it's not sending out proper signals for the function, and then it's not getting the performance that you could if the signal was proper from the body to the brain and then back from the brain to the body.
So in coordination, that's a huge thing.
Right.
You know,
because
really.
the brain needs to know what's happening with the body.
Absolutely. Absolutely. It's so important to get kids checked. And I think we're seeing about 50% of the population now over lifespan, but it should be like 100% of the kids should be getting checked.
Going into percentages and going into the nervous system, what percentage of the nervous system actually controls pain? A lot of people, they hear the word nerve and they think...
Oh, it's only like 10% or something like that.
Exactly. A lot of people...
Sensory is 10%.
Exactly.
So that's including, that's such a pain. So you're looking at all the other things that you feel.
Temperature.
Tingling, temperature, soft and rough and all the feelings. That's only 10%.
A lot of people hear the word nerve and they think, oh, nerve pain. Nerve isn't just pain. You know, only 10% of the nerve is pain. Then you have the motor control. You have the organ control. You know, everything in the body is all working through the nervous system. It controls everything in the body. So it's, again, it's not just the pain. There's so much more.
So let's talk about how we adjust kids and how we check. You know, Medicare, that's for the older people or the disabled people. Medicare. And Medicare came out with guidelines working with chiropractors, and they wanted to figure out what's the best way. And I love it. It's called the PART, which is pain is P, A is asymmetry, like
your posture.
Your posture and your head tipped and your hips forward or back, or your shoulder forward or back, and et cetera, et cetera. And then range of motion, how far you turn, how, you know, your range of motion. And then tissue, like, you know, bruising or spasms and et cetera, et cetera. And they said that in order to bill them, you have to have at least 2 of those 4 parts, 4 things of the part. I didn't want to confuse everybody. Okay, you need at least 2. And out of those 2, it cannot be pain and tissue. It has to be range of motion and pain, or range of motion and tissue, or you get the idea. That it's less important. The pain is less important than it is the asymmetry and the range of motion. Those are the 2 biggies. Now, asymmetry, they clearly understand in Medicare, our government is saying that if your range of motion isn't right, that obviously you've got major things going on. And if your asymmetry, your posture isn't right, that causes many, many things as well. And any farmer can tell you that. The crooked chicken dies quickest. Anyway, simple as that. The cow that's walking funny, that one's going to be gone quicker than anything else.
So here's a quick check that parents can do at home to tell if their children are possibly need chiropractic care, is just have them stand straight up, just a nice neutral posture.
Thank you, by the way.
And just have anyone just take a look at them, or they can do it themselves in the mirror, and just take 3 points you can do. You can use the ears, you can use the shoulders, you can use the hips, and just kind of put your hand, on their shoulder and just say, look at it real close. Is it even? If one shoulder is higher than the other one, then they probably could be a candidate for chiropractic care. There's some kind of issue going on. Same thing with the head. If the head's tilted one way or the other, if the hips are shifted one way or the other, then there's an issue, and that person should get in for chiropractic care.
And what I do is I like to say, I want you to close your eyes, march in place like a soldier, and I want you to stand like a soldier. And then, after they've marched, then I have them stand. So they have their eyes closed, they're doing their marching thing, and they stand there, and then you look at them. Because once they open their eyes, they'll readjust different things. So you can do it like in a mirror. I check myself all the time, and that's how I do it. So I do the marching thing, I get straight, and then I open my eyes, but then I don't move. For adults, we have a tendency to cheat on that. So don't do that. And but that'll give you an idea. And then from there, let's say they're tipped like that a little bit. They might have too much pillow, and they like to lay on their left side, on their right side, and they would push their head up. Or a too small a pillow, and it's tipping their head. Or they're on the phone, and they're holding it with their neck and shoulder like that. Or they fell on their head and went like that and just totally smashed their head in.
Or they play video games all day looking like this.
That's right. Or, the TV's over here and they're like this playing.
Yeah.
Things like that. So those are the kind of things you really want to watch out for. And that way you'll add years to life.
Absolutely.
Add life to years in your children.
Quick, interesting study. Insurance actuaries, I'm talking about life insurance here. What these people do is they go out and they do studies on different things that people do and determine how long it's going to affect their lifespan. So for people who sell in life insurance, it's important for them because they're betting you're gonna they don't want to pay you as fast. They want you paying them more premiums. So that to determine how much they're going to charge you, how long of a period they're going to charge it for, they do these tests. And so, for example, they say if you smoke cigarettes compared to somebody who doesn't smoke cigarettes, you don't live as long, and it's a common study. But what do you think they found out for people who, throughout their lifetime, had a severe scoliosis?
I know what it is.
Anywhere between 17 to 21 years less of a lifespan because of a severe scoliosis.
So that's the same as smoking cigarettes and drinking and...
Yep. It's horrible for you. It's 17, 20 years off your lifespan. So instead of living to 100, now you're living to 80. Or instead of living to 80, now you're living to 60.
And what about the quality of life too? If you've got the scoliosis, you might affect your breathing. It might cause pains. It might cause all kinds your heart conditions, and you're living with this
reproductive,
right. And so you're living not at the high quality of life that you could be living, and then you're dying earlier also.
And then the least important in this matter, but it's the one that people find is most important. Again, with the quality of life, pain. If you have severe scoliosis, you're living life in pain as well.
I've only had for people under long-term care, especially kids. I'm like 100% on kids, but on long-term care, I've only had like a handful not corrected. A few of them I've sent out for rods, like 2 of them. So 30
Over
years.
A 30-year span.
30-year span. 2 I sent out for rods, and like a handful we couldn't correct. Just a handful. Is all.
And
out
even
of
the
thousands.
Ones,
how many have I seen? Thousands.
Even the ones that you don't get that full correction, you still get correction.
Still a lot of correction. Correct. And that's just it. It's like amazing. Like, I didn't even know that when I first got out of school. I didn't even know I could do that. I corrected it as much, like if it was like this, and I corrected to that. I thought, okay, it's stabilizing right about there, and that's about it. But then I had people who said, well, let's just keep going. What do I care? And we still got straighter. It's like, wow.
Yep.
I thought, these were adults. I'm not talking kids here. Kids, you could straighten out like the whole thing.
Yeah, when kids are under care, they don't grow into that scoliosis. They don't get that because they're staying in line as they're growing. The adults, their scoliosis comes from years of carrying their backpack like this, carrying their purse like this, talking on the phone like this, sitting on their wallet.
I have to retract because there were a few patients too, less than a handful, that had like a hemivertebra or like a crushed vertebra where it was like.
And those are different cases as well.
That's different than the scoliosis we're talking about here. This is a
different shape
anatomical blooper.
If your bone is shaped like a triangle instead of a square.
And there's a wedge in there, and that made it crooked. I've had several, not that many.
But even that kind of case.
Like 4, maybe 4 or 3.
Even that kind of case, correction is possible, and the body, when it's growing, even though the body grows a bone that's misshapen, The body makes sure that all the joints run smoothly, and the body makes sure
they were
that the
fine.
nerves are on pinch.
Yeah,
So
yeah.
even though you don't get them 100% straight, 100% correction, you get them to their normal, and it makes all the difference in the world for them.
Yeah. Before I was just talking scoliosis, but then I remembered a couple of these heavy vertebrae. I had a couple of fractured ones.
Yeah.
So I said, wait a minute, those were different though.
Yeah.
That's
Slightly different case.
hopefully you're not like that out there. Okay.
But again, even for someone like that, the correction can still help and still get relief from the nerve interference as well.
So Toni Rodnick, soon to be chiropractor. So from the date as we're filming this, she graduates 3 weeks from now, right? Approximately?
Approximately, yeah.
Yeah, about 3 weeks from now she graduates. And so it's been quite a process.
It's been a journey.
What would you like to say to our folks out there was it worthwhile doing? Is it something that...
It was amazing. We learned so much. I know so much about the body and how it functions, and it's amazing what the body can do if it's given the correct, removing the interference, and the body can heal. And it makes such a difference in people's lives.
You know, I like to say that in chiropractic school, you learn more about the human body than any other profession in the world. And it's going to take 50 to 100 years for the world to catch up to what these people coming out of school know, because there's nothing like it. You learn more about how the human body works and functions than any profession that there is out there. There isn't anything like this. It's unbelievable.
There's a saying out there, chiropractors, we study life and what makes people healthy and vibrant. A lot of other professions out there study death. They study the things that kill people. And, granted, medical professions, they do have their place. We're studying the body as a whole. We're studying life. We're studying vibrant. They're studying, how does the body respond when you put this into it? Oh, it's got this effect, this effect, this effect. We'll call these two side effects. We'll call this one the effect. They're not studying the body. They're studying diseases, the effect of different things on the body. We're studying how the body works, what the body does, how to keep it healthy. Two different areas of thinking, yeah.
I know physiology is how the body works, how it functions, physiology. And I don't know of any other profession that teaches more physiology, unless you become a physiologist, physiology. But then we also take anatomy, so we know where everything is, and then physiology is how it functions. And then we look at neurology, and you take neurology, and you say, okay, which nerves are controlling the physiology, and where it's all at is the anatomy, and you put that together, and that's what we look for, is interference with that whole mechanism, and to reduce any interference that's there, and that way the body is allowed to heal itself just like it's supposed to.
Another thing we do too in chiropractic, we get philosophy. We get the philosophy of how the body works, why it does what it does. No other profession studies philosophy of the body, and putting that in there along with the anatomy of the physiology, the neurology, really makes a big difference. And we really do understand, this is how the body works. This is the theory of how this works. This is why. Here's a separate theory. Here's how it works. We really get it all.
They say that, you have the spiritual part, the spiritual body, and that was divided with, you have priests and all that. And then you have the physical part, they put that and they called it medicine. Where chiropractic is kind of in the middle. We're reconnecting the physical with man, the spiritual. When I say man, I mean woman too. And so that reconnected, we're the only profession out there right now doing that, pretty much, that I know of, that actually has got a total handle on that. Okay.
Dr. Paul was talking about how we integrate the science, the anatomy, the physiology, and the philosophy, but there's also a third part of it. There's also the art of chiropractic, the techniques of adjusting, and knowing how to adjust it and when to adjust it, and differences between adjusting the baby and the adult, and differences between adjusting one adult and their twin. There's the art goes along with it too, the art, science, and philosophy of chiropractic.
And it's exactly that. It is. It's an art form. If you ever spent a day in a chiropractic office watching a chiropractor, all their moves are very specific. All their moves are very planned. It's an art form. The analysis is an art, just to know this is the bone that's out, this is the bone that's moved this direction. Again, it's an art form. It takes practice.
Speaking of the art, we're going to go into adjusting extremities. Ooh. So let's take a quick break, and we'll go right back into that, and we'll bring out some extremities. Welcome to Ask the Chiropractor. I'm Dr. Corey B. Rodnick, and welcome back. We're here with Dr. Paul Rodnick, and soon-to-be Dr. Toni Rodnick. And I don't want to be pulling your leg on this, but I got a leg here. So we're going to talk about extremities. Toni, why don't you open up with a little bit on extremities?
Well, while I was out at school, Michigan changed the law to allow the chiropractor to adjust the extremities, because just as the joints of the spine become misaligned, the joints of any bone, the hand, the foot, the leg, can become misaligned, slightly misaligned, not dislocated that you would need to have it put back medically. And the way chiropractors adjust, for the first thing, the protocol for most techniques for adjusting the spine, extremity is first you got to clear the spine. Because, like we said, if the spine is out of alignment, it can affect everything, which can include the bones, the hands, the feet, the legs, the knees. So you want to clear out the subluxations of the spine. And then there's many techniques to do it. One that I use is, it uses muscle testing, because Hilton's theory states that the nerves that innervate the tissue above the joint and the muscles that move the joint also innervate the joint. So if the muscle's weak, it could indicate that you need to adjust that joint. Like if you have shoulder problems, the shoulder is not just where it comes from the arm into the body, it's also where the clavicle comes to the breastbone. They call it the sternoclavicular joint, or where the clavicle connects to the scapula, the acromioclavicular joint, and then the humerus connects to also the scapula and the glenohumeral
Which
cavity.
is a shoulder blade for all those out there. Okay.
So first step is adjust the spine. Then figure out which joint it is. If it's the elbow joint, is it the radius or the humerus or the radial? And which direction did it move? Did it move backwards? Did it move forward? Did it just twist? And there's different muscle tests that can help you figure out what it needs, and then you can adjust it. And then there's Activator has a totally different protocol to figure out which joints need to be adjusted. But again, first you have to clear the spine.
Now, again, going back to what I was saying earlier, there's a big perception of chiropractic out there in the general public that chiropractors are neck pain, back pain, headaches. A lot of times we'll get people in the office and they'll see me adjusting somebody else's extremity, or they'll mention something, and I have shoulder pain. I say, oh, well, let me take a look at your shoulder. And they say, oh, I didn't know chiropractors could take a look at a shoulder.
They had no idea.
And they have no idea. If it's a mobile joint, more than likely chiropractors can take a look at it at least. If not do something for it, at least analyze it, take a look at it, figure out what's going on.
But not all chiropractors do extremities. I just want you all to know that. That's kind of a different, it's a specialty, I would say. How's that? Yeah. And we do extremities, but not everybody does. Maybe, 20-30% of the chiropractors probably don't do extremities, and which is fine. It doesn't mean that they're any worse or better. It's just something they don't particularly do. They're more involved with something else. So.
And I want to go back into it for a second too. She was saying, protocol is always clear out the spine first. The reason that we do that is a lot of times a spinal misalignment, a spinal pinched off nerve will create pain or symptoms elsewhere. So let's say I have nerve in my low back gets pinched off going down my leg, and it's causing one of my muscles to spasm and be tight. So now I'm walking around with this tight spasm muscle, and all of a sudden I'm starting to get some knee pain. Person comes in and says, you got to adjust my knee, I'm having knee pain. Well, let's check the spine. We check their spine, clear out that pinched off nerve, and then, well, before I'm going to check your knee, let me have you take a few steps around. They say, oh, that's a lot better. You didn't even touch my knee. Well, because it's coming from elsewhere. And then the same thing goes both ways. Let's say somebody rolls their ankle. Now they're walking around with a rolled ankle. Now it's throwing off their knee, their hip, their back.
Yeah.
their other hip, their other knee, their other ankle. You know, they say, I sprained my right ankle and it's been killing me for months, but now all of a sudden, and I didn't do anything to it, my other ankle's starting to hurt. You know, everything's related to everything, and it's really important to clear everything out.
You know, most cases of carpal tunnel patients that I've had, I've corrected by correcting the cervical spine, the neck. Coming right out of the neck, down into their hand, and they think they have carpal tunnel, and they're getting ready for carpal tunnel surgery, and it's in their neck. And I adjust their neck, and it goes away. And most of the time, it's in the neck.
And then what you see is the person that isn't getting the adjustment, who does go through their carpal tunnel surgery,
and they come in and say it didn't work.
No, and then it didn't work, but then a year later, oh, they got to do another carpal tunnel surgery. You know, we got people saying, well, I had 5 surgeries on this one, 5 surgeries on that one, and it still seems like it's kind of coming back. Well, maybe the surgery isn't fixing the problem. There's something else going on there.
You know, lifting up on the head and taking a little pressure off the neck nerves coming out. A lot of times they'll say, oh, my carpal tunnel feels better. Just like that, I know. I go, okay, I know it's in your neck, obviously. But, and then, I mean, there's an insurance company that has a 90% chiropractic rating of correcting carpal tunnel without the surgery. They took a bunch of people who needed surgery, and then they sent them to the chiropractor. They did this. It was out of Chicago. It's an insurance company, like Aetna or one of these companies. And they said, hey, we're not going to allow carpal tunnel surgery unless you see the chiropractor first. And let, you know, and then there's still the there's 10% though still needed surgery. That's a lot better than 100% of them needing surgery. So anyway, let's take a look at this. So I have the foot in my hand, so we're going to go into the foot for a second. A lot of people will, as they're walking along, this is a right foot, I believe. And if you've seen somebody like you talked about earlier is turning the ankle, so the ankle would turn this way. And what happens when that happens, this is the big bone you have right here. It's called the fibula, and this is the tibia. Or do I have that backwards?
Yeah, reverse that.
Tibia, fibula, the little guy on the side. Most people don't even know they have one. And so this is the talus. This is called the talus bone. It doesn't matter, ankle bone or heel bone. Here's your heel bone here to the calcaneus. And what I'll do, this thing will misalign, and it kind of turns this way. And you can see how this bone would be involved, this bone would be involved, this bone would be involved, and your ankle bone would be involved. So there's a bunch of bones right here. If you take a look at that, there's 7 right here, just in this little ankle part, plus 2 in the leg, and then all the other parts that go with it. But
now what I want to point out too is the long bones. So let's say you have a misalignment in the ankle. Now those bones are out of place down there, but it's it's one bone. So when you get a misalignment in the ankle, you follow it back up, and also you have a misalignment in the knee.
And then that goes to the hip.
And then it goes into the hip, and then it goes up the spine. So when we adjust that, for me, most of the time when I'm adjusting that for the twisted ankle, I would bring this bone out a little bit, set this one usually comes out forward, put that back in. This now can close back on it, and normal function in your ankle again. And a lot of people will twist an ankle and then do nothing with it. So it's healing in the wrong position. So the muscles, ligaments, and tendons are all now going to heal it. While it will heal, but in the wrong position. You think, well, it's not broken. Obviously, if it's broken, you got to set it and all that. Like you said, if it's dislocated, that thing will be hanging sideways. If you've ever seen somebody with a totally dislocated, I mean, the thing comes totally out and it's like hanging on the side. We're talking about a small misalignment and then leaving it in that position. So now you're going to have tendency to hurt that ankle on a very regular basis.
You see it all the
time. Because every time you're walking, you're hurting it some more. So
people coming in, they say, oh, I have ankle problems, but that's because I've rolled it 800 times. Well, you're rolling it so much because it's not a stable joint.
It's not a stable joint to begin with at this point. So that would be the ankle. Let's go over, you could talk about that.
Again, in the wrist, just like in the ankle, there's a number of bones. And they connect to the fingers. And then the forearm is a unique situation. It's got the the two bones in the forearm, and you rotate it, and they cross over, and it pivots upon each other. So if you, and the elbow, and the whole thing, like the ankle, there's a whole kinetic chain. If you misalign something here, it can affect the elbow, which can affect the shoulder, which can affect the spine, can affect the other side, and can affect, since it goes up to the neck, it can cause headaches and stuff. So you want to check the spine first, and then make sure that everything is lined up properly so that it pivots, it functions.
Last year I was electrocuted, and I think I misaligned every single joint in my arm, both arms. Totally like dislocated both shoulders, elbow, everything.
And that's because when you get the electrocution, the muscles all go into a spasm, and they pull out everything because it's uncontrollable, and it's very powerful spasms. So it could misalign everything.
It did. It wasn't fun. Yes, Dr. Paul.
I just was different topic. I was just thinking about the carpal tunnel that we were talking about earlier. I just want to kind of explain a little bit about how that works. So these bones right here, there's 8 little tiny marble-like bones that kind of roll around, make it so you can roll your wrist. Those are called the carpal bones. And then there's a tunnel that kind of burrows through them. And on one side you got a tendon, more or less, covering up, and that makes your tunnel. And then there's nerves that are going through. There's a couple things going through there, but when the nerve that's going through there gets pinched, then you get the carpal tunnel syndrome.
And it normally forms like a tunnel that's like an arch, and then the tendon on the bottom, and the nerves go through, and that arch can fall down.
So when the bones move out of place, the arch on top puts pressure in, and then when they come in for the carpal tunnel surgery, what they do is they cut that ligament, and they just make it so the tunnel has less pressure in it, but they're still not fixing the alignment, and that more or less doesn't fix the carpal tunnel surgery. And when people come into me and they say, "Oh, I have carpal tunnel," I always tell them the same thing. Well, I have 2 of them. Everybody's got carpal tunnels. Do you have carpal tunnel syndrome? Let's find out. Let's take a look. See if it's coming from the wrist, see if it's coming from the elbow, the shoulder, the neck. Those nerves that go all the way, and those signals go both ways. So you got signals going up to the brain, signals going back down to the body. Can be pinched off anywhere. Just because you have wrist pain doesn't mean you have carpal tunnel syndrome. Like I said, everybody's got carpal tunnel.
And it can be pinched in more than one location, too.
And it can be pinched in more than one location. And that's actually called double crush syndrome, where let's say it's pinched off in the neck and in the wrist. So let's say it's pinched off my neck. That nerve's been pinched off 25%. Now it's pinched off in the wrist, where it would be another 25%, but together they don't equal 50%. They equal 75%, 90%. It's the double crush. Triple crush is even more so. If it gets pinched off in more than one place, you're really feeling the effects of that.
Well, I had fun with it too. So right now we went over Children and Chiropractic. We talked about extremities, and now we're going to do a little bit of exercise here to go over to help strengthen your body's form, posture, and we're going to see you back in a minute.
All right, and welcome back to Ask the Chiropractor. As always, today we're going to end off with some exercises that we're going to recommend you do day-to-day basis. We recommend you do these exercises as often as you brush your teeth. These are called spinal hygiene exercises, and spinal hygiene exercises are similar to dental hygiene exercises. You do them once a day, twice a day, well, 2 or 3 times a day. Same thing, we recommend you do these exercises as often as you brush your teeth. Keep your spine healthy. Couple of different mnemonics we're going to use. We're going to start off with our flying friends. We're going to have 3 flying friends. We're going to work from biggest to smallest, but before we do that, we're going to start off in a position that we like to call the inner winner position. So the inner winner position, we're standing up nice and straight. We got our shoulders back. We got our tummies tucked in. We got our head right over our shoulders. This is the inner winner position because if you've ever been to a sporting event or anything and seen what the losing team looks like, you see them walking around like this. We don't want to be that. We want to be those inner winners standing up nice and straight. So we're standing up nice and straight. We're going to start off our first exercise, the biggest of our flying friends. It's going to be called the eagle. Now the eagle, what we're going to do is we're going to start with our arms down to our sides, and we're just going to bring them up slowly. And as we go up, we're going to tilt our head back. And bring it back down. And when we're going up, we're going to take a deep breath in. When we're going back down, we're going to breathe out. Going to go up again. And we're bringing our head back, breathing in. You should feel your whole spine stretching right out, and go back down. When you go down, you don't bring your head down. You just bring it right back to neutral. Okay? Do it 2 or 3 times. Really good for just keeping motion in your spine, stretching it out. Really great exercise to keep your spine healthy. Our next exercise is going to be called the Hummingbird. Now for the Hummingbird, what we're going to do is, again, same inner winter position, except this time we're going to bring our arms out to our sides. And what we're going to do is we're just going to make small circles backwards, really focus right between our shoulder blades. Now what we're doing here is we're strengthening the muscles in our back. We're trying to avoid this position. We have too many people out there using computers, driving in their cars, playing video games, end up with their shoulders forward, their heads forward. So we're trying to avoid that. We're strengthening the muscles right in our back. A couple of variations we can do on this one. You can kind of raise your arms up a little bit, just kind of work a little bit different muscle group. You can bring it down a little bit, work a little bit different muscle group. Bring it back up to neutral. Another variation we have is called the Drunken Hummingbird, where we just kind of fly a little bit crooked. And make sure, as always, do everything both directions. Our last flying friend, our smallest flying friend, is going to be called the hummingbird, or I'm sorry, the butterfly. And with the butterfly, what we're going to do is we're going to take our hands, link them together, and put them back behind our head. Now, what we're not going to do, we're not going to be pushing forward with our hand into our head. What we're going to be doing is we're pushing backwards with our head into our hands. And just light motion, just kind of press back, just enough pressure that you can kind of feel it. What we're doing here is, again, we're working these muscles in the back of the neck. Again, all those habits that people are doing these days, really bringing their head forward. We're trying to avoid that. If you've ever seen the old man walking around like this, that happens for years and years of degeneration. We want to make sure we're keeping our heads up. So just light pressure, and then relax it, and then light pressure again, and then relax it, and just enough to it we're strengthening the back of our neck. So again, to recap, we got our three flying friends. We got the eagle, we got the hummingbird, and we've got the butterfly. Last thing I'm going to show you, just a quick one to help you relax. This one's called the trap opener. We got these muscles right here. These are your trap muscles. Basically what we're going to do on this one, this is going to be the only one that I'm going to tell you to drop the inner winter position. You can just kind of lose your posture for a second, and what we're basically going to do here is just kind of massage our muscles. It's called the trap opener. So we're just opening up those muscles. You can do it one hand at a time, just kind of work both sides. You can do two hands, you can kind of cross them over, but really just kind of work into those muscles. Give yourself a massage. You've had a long day, you deserve it, but really help out with that. Makes a big difference. So those are our exercises for today. Again, we're going to recommend you do those exercises as often as you brush your teeth. But thanks so much for having our show today.
Guys, that was terrific, and thank you for teaching us that. Dr. Paul Rodnick, soon to be Dr. Toni Rodnick.
Fantastic. Thanks so much.
We'll see you again at the next Ask the Chiropractor.